Peter Aldous.
Thank you very much, Mr. Deputy Speaker. I congratulate the Honourable Member for Putney for securing this debate. Prior to the pandemic, my engagement with the dental sector led me to form a number of views on how it served our communities. Those who working in dentistry are highly competent and well-qualified professionals. There are problems in recruitment, and it is increasingly difficult to find an NHS dentist, and when good and highly respected dentists retire, they are very hard to replace. There is a lack of accountability in NHS England and improvement, and the world of UDAs, that's units of dental activity, is opaque and difficult to understand. One readily reaches the conclusion that in normal times, this is a system that is not working in the best interests of local communities and their public health. Covid-19 presents those working in dentistry with enormous challenges. They're placed in a position of a significant health risk. There is a dramatic reduction in capacity, and there have been some problems for those working in the sector being recognised as key workers. The government were right to set up a network of urgent dental centres, and in many respects, this has worked well, though I have received a lot of complaints about where and how to find them, being kept waiting on the phone for seemingly hours on end, and then difficulties in getting an appointment. Not only is there the challenge of getting through the current lockdown, but the shadow of COVID will hang over the sector for a very long time. There is an enormous backlog of work, and yes, while some of this may be classed as non-emergency, it is important to bear in mind that so often a routine visit to the dentist can pick up cancer at an early stage. The position, Mr. Deputy Speaker, has been exacerbated by the government writing to dentists before Christmas, seeking to impose a 45% target of UDAs for January, February and March. This proposal has been described to me by a dentist in my constituency as being completely irresponsible, disrespectful, neglectful, unsafe and inconsiderate. Mr. Deputy Speaker, it needs to be dropped, and the government need then to work with dentists to come up with a short-term plan to get through the immediate crisis, and then to produce a long-term plan that is easy to understand and with proper accountability, provides full national coverage of NHS dentistry, and ensures that the recruitment and retention of highly trained professional staff. Thank you.
Thank you, Peter. Video link. Sarah Owen.
Thank you, Mr. Deputy Speaker. Like so many aspects of our lives over the last year, this pandemic has meant changes for dentists and our constituents as patients. During the first